Today on Kidney Health Made Simple, we're covering the 6 surprising things that can harm your kidneys. Your kidneys are powerful, but they're also vulnerable. So, we want to cover some of the common, maybe some surprising things that can damage them over time. So, let's dive into it, Dr. Hashmi. What are the 6 things that can harm your kidneys that we want people to be aware of?
All right, let's start with high blood pressure, specifically how it impacts the kidneys. So it turns out that what ends up happening is when your blood pressure in the body is high, that actually leads to higher blood pressure in the kidneys. We call that increased glomerular pressure. And what essentially that high pressure in the kidneys ends up doing is it actually creates all this pressure on what we call the ball and the tubes coming out. So the glomerular part of the kidney. And so this is the part of the kidney that's responsible for filtering out all of the waste products. And essentially what ends up happening is the more pressure you continue to apply to it, the more damage there is. We call that damage glomerulosclerosis, or basically there's scar tissue that's forming in there. Now, this scar tissue, what it ends up doing is it affects the kidney's ability to filter the blood, specifically to get rid of the waste products and to also regulate your volume. So in other words, when people talk about I got swelling in my body because I have advanced kidney disease, part of that is because that scarring that's starting to occur inside the kidney. Now, one of the markers of this is, of course, protein in the urine, or what we call proteinuria. And so when you start to take all of this together and you look at blood pressure, the goal of blood pressure is really to keep that top number less than 120 ideally. And then what I call good enough for government work is less than 130 millimeters of mercury. So ideally less than 120, and okay, less than 130, the bottom number is less than 80. And remember, as you're starting to think about this, you want to remember that you have to check your blood pressure. So when you talk about blood pressure, there's actually 4 different types of blood pressure you should be concerned about. First one is what we call white coat. That's where you show up to the doctor's office, and because you get nervous, you think the doctor's going to say something mean to you, your blood pressure's high, but when you go home, your blood pressure's okay. The other one is really strange, and I've never understood why, but it's called masked hypertension. And masked hypertension can actually show up more so in chronic kidney disease, and there's a higher risk of faster progression of chronic kidney disease. So masked hypertension is where you come to the doctor's office, even if the doctor says something bad to you, your blood pressure's okay, but you go home and your blood pressure's high. Then the other 2 types are, one is called dippers and the other is called non-dippers. So dippers are where your morning blood pressure may be a little bit higher, but towards the end of the day, as your circadian rhythm is changing and you're winding down for the day, your blood pressure goes down. Non-dippers, for once again, some strange reason, as the evening rolls around, their sympathetic drive, their fight or flight goes up. Maybe they're afraid of the dark. I don't know what it is, but their fight or flight goes up. And as a result of that, what ends up happening is they have higher blood pressure in the evening. So in terms of the highest risks, you have to be concerned about the masked hypertension, because most people don't think about it. And you got to be concerned about the non-dippers. And finally, when you're thinking about these things, remember, we talk about lifestyle, but we also talk about medications. And you are not saying, I'm going to stop all my medications because I'm doing a particular diet, or vice versa. There's a combination needed, because the longer your blood pressure stays elevated, the more damage you're going to end up doing.
How many times a day should someone check their blood pressure?
Well, so once again, if you're trying to find out if you're a dipper or non-dipper, you got to check a morning and an evening. All right, let's dive into high blood sugar and how it impacts your kidney health. So what ends up with diabetes is diabetes ends up damaging all the blood vessels in your body. And they do that because higher levels of blood sugars that's floating around in your body, they increase something called oxidative stress. They create all sorts of inflammation. Remember, just about every single chronic disease is linked to inflammation. So our goal always is, how can we lower inflammation? But inflammation is a key thing. And the final part of this is endothelial dysfunction. That's a fancy word, but essentially what it says is that the lining inside your blood vessels, that's the endothelium layer, that part of it, it starts to not work as well. The flexibility in it goes away. It starts to become more resistant. So this is happening all over the body, including the kidneys. But specifically in the kidneys, the other part is kind of like what we were talking about with high blood pressure. Higher blood sugars will lead to higher blood pressure inside the kidneys. We call it glomerular hypertension. And so what happens there is there's scarring that's occurring. We call that glomerulosclerosis. There is the basement membrane, which is kind of like a barrier through which things are going to filter through. It starts to thicken, it starts to become stiff. The individual cells, what we call podocytes, these are sort of the ends where stuff filters through, they become damaged. Bottom line is what? That barrier in your kidney that's sort of holding things in and only letting waste go through starts to break down, and you start to spill protein in the urine. So we'll call that albuminuria. Albuminuria standing for albumin in the urine, or one type of protein. So then when you talk about blood sugars and so forth, remember, diagnosing diabetes, and I even say pre-diabetes, is very critical because you want to know. Now, if you start to look at, well, what's the number you should aim for? Your doctor will oftentimes say the target is really to have an A1C less than 7. Normal is an A1C less than 5.7, and diabetes is above 6.5. So if you think about those numbers and you say, wait a second, if diabetes is above 6.5, why is my doctor saying I just need to be less than 7? Because some of the data shows that if you're too aggressive with medications or insulin, you can actually increase the risk of complications. For example, low blood sugars causing somebody to pass out, hit their head, etc. So what we tell patients is, yes, the data shows less than 7, but that's where lifestyle comes in. We want you to use lifestyle, sleeping more, moving more, creating better relationships, reducing stress, eating more whole foods, all of that together to help bring your A1C into the normal range. And then in terms of just some basic things is, if you're a type 2 diabetic or a type 1 diabetic, it is important that if you've had diabetes for 5 years, that you start to make sure you're getting annual screenings for checking protein in the urine. This sort of check of protein in the urine is very important, because if you're not checking for it, that little bit of protein that's spilling, there are zero, once again, zero symptoms to it. You're not going to have swelling, and there's no magical food that you're going to be able to eat that's going to reverse any of those issues. Now, what about dehydration? So there are two types, right? There's something called acute, or occurs right away in 24 to 72 hours or under is acute. Chronic is more than 72 hours. So when we talk about acute dehydration, the biggest thing we're worried about is you're reducing the blood flow to the kidneys. And this can potentially result in, once again, cells in the kidney that can starve to death. And so you have, quote unquote, ischemic damage. That's the medical term for essentially saying some of the cells starved inside your kidneys. Now, with chronic dehydration, by the way, none of us drink enough water, and we've had a really good episode on how crazy amounts of water, meaning people were like going crazy with it. That's not healthy, but at the same time, that's not an issue. For most people, they don't get enough water. And it's funny I should say that while I'm drinking my coffee. So yes, I don't practice what I preach. No, I'm kidding. So chronic dehydration, what ends up happening is there's lots of mechanisms around this. So in medical lingo, it's because certain things like your vasopressin levels, they start to change. There's higher levels of them. There's higher levels of certain pathways, like you can have higher amounts of uric acid building up inside the body because you are dehydrated. You can have activation of these pathways, the aldose, reductase, fructokinase pathway, a very long word, but the bottom line with all of these things that they have in common is chronic dehydration. Through these pathways, you're going to get fibrosis or scarring, you're going to get inflammation, and put it all together, you're going to have progressive loss of kidney function. And so as this is happening, don't forget that there's some of the most basic things that can happen, like kidney stones. Why do kidney stones form? Because if you keep drinking enough water and peeing regularly, debris can't collect to form a stone. It's literally that simple. So by having good urine volume that's flowing, you prevent kidney stones. By having less urine volume, you allow for concentration, and concentration of urine is what causes kidney stones. And then finally, just, the big stuff that you want to understand is if you talk to a bunch of nephrologists and you say, well, what's a good advice? Most nephrologists will tell you, especially when we talk to patients with kidney stones, is you want to drink enough water to make 2 liters of urine a day. That's it. That's literally how we took it. So notice, I didn't say drink 2 liters of water. I said drink enough water to make 2 liters of urine, because then you're ensuring that your kidneys have enough flow through to prevent anything major happening. And just keep in mind, as you get older or wiser, whichever word you like better, signs of dehydration are much harder to tell. So if you're waiting for, your urine color to change, or waiting for dry mouth or increased thirst, you may miss all of those signs until it's to a point where you're actually becoming dizzy or becoming confused, or your blood pressure is dropping. So with age, and of course, very young people, so children, as well as folks who are older and wiser, you need to be very mindful that your typical signs of dehydration may not show up in the same way.
Yeah, and that's helpful to know because I think a common question might be, well, I'm not measuring my urine. How do I know if I'm producing 2 liters of urine output or not? Like, what can people look for? Or is it just best, hey, just make sure that you're consistently drinking water throughout the day to prevent that chronic dehydration that you might not have
Well,
symptoms of?
yeah, you can always measure your urine. In fact, that's how we test for kidney stones, is by collecting urine for 24 hours. And we do this really cool thing of giving you a jug and telling you store it in the fridge. But for the mere mortals who don't feel like wanting to do that and explaining to your significant other why there's a jug with pee inside your refrigerator, just remember, you're really aiming for a very light yellow color to the urine. That's just a very simple, old school way of knowing. It should be very, very light. And that's what you're looking for, and that's a good sign. And then so every time you go pee, now, of course, if you take any B complex or B vitamins, it's going to be fluorescent yellow. So there goes that idea. So once again, aiming for 2 liters is important. That translates into most people of about 2 to 2.5 liters of water intake, accounting for sort of non-kidney related water losses, sweating, etc. All right, so when we talk about certain medications in terms of kidney disease, the one that pops up for everybody is what we call the NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. And those are the common household drugs like ibuprofen, naproxen, or naproxen, depending on how you want to say it. And essentially, the way that they harm the kidneys is, in the medical terms, it's they inhibit the COX enzyme. But what the COX enzyme does is it produces these things called prostaglandins. Prostaglandins will help in terms of maintaining kidney blood flow. So you want prostaglandins to be there. And as you start to think about, dehydration or anything else, prostaglandins will help to maintain the blood flow to the kidney. But if you use NSAIDs, naproxen, ibuprofen, Aleve, etc., whatever names you want to think of, what you're going to end up doing is these NSAIDs will actually reduce the blood flow to the kidneys. They will cause, the medical term is vasoconstriction. And what that leads to is acute kidney injury. Why? Because you starve the kidney. So when people start to take NSAIDs regularly, so you can do it acutely by taking too much NSAIDs and being dehydrated, you can cause acute kidney injury. But when you start to take them over a long-term basis, you're popping in Motrin or whatever it is every day, you have different mechanisms. And those are things like interstitial nephritis. You can even get full-blown nephrotic syndrome. So what do these terms mean? You have acute inflammation and scarring that's now building on itself over weeks, months, years. And then you can get full-blown nephrotic syndrome where the barrier to the kidney breaks open and you're spilling all of this protein out into the urine. Then if we switch gears and we start to talk about other things, there's antibiotics. The most common antibiotics in this class are aminoglycosides and vancomycin. And these are very common, and your doctors will all have heard of them because they're in every single test that we as physicians always have to take. But what you want to know is aminoglycosides, the reason they matter so much is they go inside the kidney, specifically in the proximal tubular cells, and they go and they get stuck in there and they stay there, and they can reduce the blood flow to the kidney and cause something called acute tubular necrosis. In other words, cells inside your tubules are dying. Then there's things like vancomycin, and vancomycin can also cause acute tubular necrosis, or ATN, and it can also cause a different type of reaction, which is more inflammatory, called acute interstitial nephritis. So when you're talking about aminoglycosides, remember, you can think of those as all sorts of names, but common things like Bactrim, for example. With Bactrim, you'll see that you can get both ATN, AIN, you can even get crystal formation. Bottom line is, if you're being given any kind of antibiotics, your doctor will always want to monitor you closely. They will check your blood test. You want to make sure that you take it as prescribed. And if you're going to someone that, hasn't seen you before, if you have kidney disease, make sure you tell them about it. The other category is things like antacids, Tums. And people don't talk about these enough because there's this idea that, things have changed and so forth. But some of the antacids can contain things like aluminum or magnesium. Now, magnesium is really hard to get toxic, but you really need a high dose. But you have people popping in antacids every single day, multiple times a day. And so for those people, they can accumulate things like aluminum. And when you start to talk about heavy metals being stuck inside the body, it's very hard to get rid of them. And aluminum will cause aluminum toxicity. But in terms of magnesium, once again, very hard to get there, but there are cases of high magnesium levels. And then when it comes to, sort of supplements and all that, just keep in mind that there isn't a lot of data on what supplements are there, but sometimes it's not the supplement itself. It's the manufacturing process that introduced the heavy metals, the leads, the mercury, the cadmium, the arsenic from the conveyor belt or the factory. And that's how it got in. And because some of the more inexpensive or cheaper brands out there, they don't have third-party testing. Because they don't have it doesn't matter like what study they tell you their own lab did. You need third-party testing to ensure that all these other contaminants are not in there.
Okay, so let's then talk about specific foods and supplements that can be toxic to the kidneys. The only nephrotoxic food is star fruit, which, depending on where you live, it may be a common food consumed, or you may have never even heard of it. But star fruit contains naturally occurring toxins that in healthy individuals, the kidneys are going to filter out. But when there's impaired kidney function, there can be difficulty filtering that out. And so therefore, it's recommended people with kidney disease should avoid star fruit. Outside of that, there's no specific, like this food is toxic to the kidneys, but there are some different things to take into consideration with supplements and herbal supplements. So one is excessive vitamin C supplementation. We've talked about in other videos, but vitamin C is a precursor to oxalate production. And so typically high dose vitamin C supplements aren't recommended for people with kidney disease. And this is usually 500 milligrams or more of supplemented vitamin C. People don't need to worry about the vitamin C that's naturally occurring in the fruits and veggies that you eat. And then when we get to the herbal supplements, they're so tricky because they can be damaging or cause adverse reactions for different reasons. So like you mentioned, it could be that they contain heavy metals, or it could be that this herbal supplement has a diuretic effect. And if you're taking it in conjunction with a prescribed diuretic medication, then there could be dehydration or irritation to the kidneys. And so, unfortunately, ultimately, it really comes down to the individual and what medications they're taking, their stage of kidney disease, other health issues and concerns that they may have. The National Kidney Foundation actually has a good list of supplements that you may not want to take if you have kidney disease, things like cat's claw or maybe licorice root. But then it also has a list of, hey, these supplements contain potassium, these supplements contain phosphorus, these supplements may be one that you might not want to take. And so then you can look at that list, and ultimately you just want to go to your provider, and any herbal supplement or vitamin supplement, mineral supplement that you want to take, ask your provider, like, hey, does this interact with any medication or supplement I'm currently taking? Um, Tell them why you want to take that. Like, what did you read about how it can help you and why you want to take it? And then what is a safe dose and a safe duration for you? And the duration is also key, because sometimes taking a certain supplement might be okay to take in a short term time frame. But if people, like you mentioned with some of those antacids, if they're taking them or NSAIDs over very long durations, and especially in large quantities, that's where it could potentially be toxic for the kidneys. And then other nutrients that aren't necessarily toxic for the kidneys, but when consumed in like an excessive additive form, like phosphorus additives or potassium salts, those are things that may not be good for the kidneys. It's not that they're necessarily toxic, but they can still lead to other side effects or complications if they are taken in these like more highly absorbable additive form.
All right. So for the last one, it's smoking and vaping. So needless to say, both of these will, guaranteed, they will harm the kidneys. And the reason they'll harm the kidneys is because there are so many mechanisms. For example, when you start to think about blood vessels, nicotine, so you're talking about cigarettes who have hundreds, if not thousands, of different chemicals in them. But even nicotine and all the other stuff in there, they all damage that lining of the inside of your blood vessels, the endothelial layer. They cause inflammation, they cause scarring, they kill those cells. And when it comes to specifically at the kidney level, they actually drop the blood flow to the kidneys. That's called vasoconstriction. So you have less blood flow, and the kidney has this elaborate mechanism where it says, look, if I'm dying, I will go ahead and commit suicide on my own to preserve the rest of the body. So because there's already vasoconstriction, it launches into this entire cascade to make that vasoconstriction worse, in the hopes that there's more blood flow going to the heart and the brain. So it tries to save the heart and the brain by sacrificing itself. But what it doesn't realize is there's no problem with the heart and brain. This is just coming from smoking. And so that's why when we start to talk about this, it's so important. Remember, nicotine, it activates so many things. It activates something called NADPH oxidase. And the reason this matters is because you're creating these things called reactive oxygen species. These guys create all sorts of inflammation inside the kidneys. They're terrible for the body. They make you age very, very quickly. And as a result, they start to damage the kidney from the inside. So what ends up happening? You start to break the glomerular basement membrane, that filtration barrier. You start to spill all your protein. That's where, if it's very advanced, you'll start to see things like swelling happening inside your ankles. Eventually, the fluid starts to build up in your lungs. So bottom line, when you start to get around to smoking, vaping, any combination of those, none of those are safe at all. And so then, as far as things go, is if you start to think about smoking and vaping, these are really highly addictive conditions. And if you work with your doctor, we have so many new treatment options that can help you to be able to get off that. But the most important thing is, even if you've been smoking all your life, today is a great day to quit.
Okay, so let's recap those top offenders, the 6 things toxic to the kidneys. Number 1 is going to be high blood pressure. Number 2, high blood sugar. Number 3, dehydration. Number 4, overuse of certain medications. Number 5, starfruit or some other, natural supplements or remedies. And then number 6 is that smoking and vaping. So many of these risks are preventable. Our goal is to spread awareness. All the small changes that you make a huge difference in protecting your kidneys. So if you found this video helpful, please subscribe to our channel, share it with your friends and family, and we will see you guys next time.